Welcome to the Plant-Free MD podcast with Dr. Anthony Chafee, where we discuss diet and nutrition and how this affects health and chronic disease, and show you how you can use this to optimize your health and happiness, both mentally and physically. All right. Hello, everyone. This is Dr. Anthony Chafee here with you again for another episode of the Plant-Free MD podcast. Today, I have a very special guest, a neurosurgeon over from Queensland, Dr. David Johnson. Dr. Johnson, thank you so much for joining us. How are you?
Good morning, Anthony. I am fantastic. Thanks. I'm delighted to be having the opportunity to have another talk with you. We've had a chat a little while ago, but it's been a long time, and I'm following your work, and it's wonderful to see that another neurosurgery colleague is doing good work outside of the neurosurgical specialty. I think it's extremely important, and it's kind of like as medical professionals, our obligation when we have this opportunity to educate patients.
Yeah, absolutely. So for people who haven't come across you and your work, can you tell us a bit about yourself and your practice?
Oh, sure. Studying medical science probably for getting close to 30 years now. I started medicine in 1990, and I sort of worked my way into the specialty of neurosurgery. And now I run a private practice in Brisbane City. My practice predominantly manages people with spine pain and disability. So, yes, I do perform spine surgery, but I see my role as a surgeon to do everything I can to educate my community and my patients to try to avoid surgery. Okay, surgery is a highly invasive intervention. And one of the offshoots of that is that about 8 years ago, I developed a rehabilitation program that has the focus of curing back pain symptoms. And back pain is one of the leading causes of disability on our planet, not just in Australia, but effectively in every modern culture. Back pain is first or second in terms of economic or a clinical burden of disease. So it was clearly a big problem. And for the first part of my career, I was just seeing so many people with this condition, back pain. And it sort of was like a light bulb moment when I realized that patients weren't actually getting treatment that addressed the cause of their back pain symptoms. They were getting multitudes of interventions that addressed the symptoms of back pain, but the paradigm for managing spine-related pain and back pain was to not really identify the root cause of the symptoms, and that's the basis of my my rehabilitation paradigm, is treating the cause, not in conjunction with the symptoms. And I started to sort of see very close parallels with metabolic health as well. You know, there's so many treatment options out there to improve on people's metabolic health, and it becomes almost confusing. We just have so much information at our fingertips now that people are lost. And it's so bizarre. I mean, you must think that yourself, like, why is it so hard for people to be healthy when it is just a natural process? When a baby's born, it knows what to do. Okay, it's hardwired in our DNA to start drinking milk from their mother. And as the baby gets older, it's hardwired in their DNA to start crawling, to start squatting. And when you actually look at babies moving from a musculoskeletal biomechanical point of view, you can see perfect movement proficiency. And no one taught them anything. But when you look at patients, you can see very clearly their movement proficiency is completely corrupted. And of course, they suffer the consequences of that, which is musculoskeletal pain and disability. And then you look at their diet and you say, why are you eating that? Like, that's not what our metabolism, our liver, our physiology was designed to eat. And now you've got to do your job as a doctor. You can't miss that opportunity when you have an engagement with a patient. And I became obsessed with not allowing that opportunity to slip by, and not give them some form of information about their metabolic health as well. So that's why metabolism and nutrition is another thing that I'm very passionate about, as well as the specialty of neurosurgery and spine related pain. They kind of run parallel with each other.
Yeah. Well, and that's great that you.
So that's kind of where we're at now. And
no, sorry, go on.
Yeah. Oh no, so that's kind of where we're at now, and really enjoying spreading the word through in interactions with people like yourself, low carb down under, in terms of the metabolic health side of things, and in terms of the musculoskeletal side of health things. We're trying to really rewrite the guidelines for back pain management, and the latest initiative that I've established with some colleagues is a new college, and we call it the College of Functional Movement Clinicians. Okay, because that's kind of an entirely new skill set and specialty that focuses on movement proficiency as a paradigm to treat back pain.
Hey guys, just want to take a second to thank our sponsor at Carnivore Bar. I don't promote many products because honestly, all you need to be healthy is to just eat meat. But for those times that you're out hiking, road tripping, or stuck at work and you want a nutritious snack that is just meat, fat, and salt if you want it, the Carnivore Bar is a great option. So I like this product not because it's just pure meat, but also because I want the carnivore market to thrive as well. And the more we support meat-only products, the more meat-only products there will be available in the mainstream. So if this sounds like something you'd like to get behind, check it out using my discount code Anthony to get 10% off, which also applies to subscriptions, giving you 25% off total. All right. Thanks, guys.
So as far as your treatments go, so this is a lot of movement related treatments. Is that the mainstay? And then do you tie in diet as well?
Well, when patients come to us with back pain, I kind of try to work through their understanding of why they are in pain. And for the most part, they are feeling pain because of the expression of nociception or inflammation. Okay, these are the primary ways that our body communicates pain from our extremities to our brain. And there are other ways of the body perceiving pain. Neuropathic pain would be the third. And then there's another layer of pain which we call the central pain, and that's a sort of a new level of pain that arises when we don't do a good job of managing the peripheral structural nociception and inflammation well. The brain kind of goes, okay, well, if you're not doing a good job managing my arthritis, for example, or my disc annulus, the disc capsule strain, if you're not going to do a good job of allowing that to settle robustly, then I will reset the pain thermostat, so to speak, and that's a central nervous system problem, and that kind of happens in the chronic phase of pain, but we need to really help people in the early sort of immediate phase of when they start feeling pain, so that they don't develop that secondary neurological central sensitization form of pain, which is extremely difficult to untangle once it entrenches. It's a little bit like a PTSD, but it's a PTSD of pain. And everyone knows that those kind of central nervous system disorders are really hard to unravel, depression and post-traumatic stress disorder, anxiety. But you've got to realize that patients have to realize that pain can manifest in a similar way where the symptom is pain, not necessarily anxiety or depression or post-traumatic stress. So what we need people to understand is, why does their joint transform from a normal 50-year-old facet joint or spinal joint or sacroiliac joint? What is the mechanism by which that joint transforms into a painful, inflamed joint?
Mm-hmm.
And clearly, the sole purpose of joints in the musculoskeletal system is movement. Mm-hmm. That's why we have a musculoskeletal system primarily, is movement. Obviously, there's support and supporting our organs and locomotion, but movement is the key reason why we have a musculoskeletal system. And if that musculoskeletal system is failing, it by definition means that our movement proficiency is failing. Okay. So if we are going to resolve that movement dysfunction, the primary and default methodology of helping that patient is to deliver movement therapy. And that's a difficult concept for people to understand at first, because they will have all been guided down the conventional paradigm of doing lots of exercise, lots of core strength, lots of stretching. They will have all done some physical manual therapy, such as chiropractic therapy or foam rolling or adjustments, osteopathy. There's countless different types of physical therapies that people do, and they kind of think that they've done movement therapy, but they haven't. They actually haven't been upskilled, and that's one of the characteristics. That's a key characteristic of a functional intervention, is that I have upskilled my patient. Okay, and you can sort of say the same for understanding of diet as well. Upskill their knowledge, and 99% of interventions that are delivered for patients are couch-based. Okay, they come on into the studio. Oh, where does it hurt? It hurts in my back. Okay, lie down. Let me do some dry needling, acupuncture. Let me release the tight muscles. There is no way that a patient can enhance their movement skill when they lay down on a couch.
Okay.
And then for the last couple of minutes of the meeting, they might receive a piece of paper and say, go home and do these exercises. Right? Yeah. So that's kind of the paradigm in a nutshell. And that's, once patients walk out of the room, they go, oh, okay, I get it. When can I start? And why didn't someone tell me this 10 years ago? So that's quite a satisfying moment when people realize, oh, I've been doing the wrong thing.
Yeah. Yeah. And so how would movement therapy differ specifically from the traditional PT exercise or things like that? What's sort of the difference there?
Oh, excellent question. I mean, if you think about exercise as being something that is discretionary, and fitness as being something that's discretionary, and people choose to develop their level of functional capacity or fitness that suits their lifestyle. Okay. But movement skill is mandatory. Okay. So what you've kind of got to do with patients is say, okay, well, I've got to teach you the alphabet before you can write a sentence. Or if you really get good at writing the alphabet, you can write a thesis, or you can write a novel. Or I've got to teach you to count before you can do algebra. And how far you take that skill of understanding the alphabet and counting is totally dependent on you. So exercise programs are kind of putting the horse before the cart. The patients haven't actually, or they did when they were a child or a toddler, they had movement proficiency then because it's actually hardwired in it. But modern society has corrupted their expression of movement proficiency. And so when they try to exercise to get better, they are exercising with movement dysfunction. So that kind of sort of sends them crashing back down again, because you can't start to overlay capacity before you've actually acquired fundamental proficient movement biomechanics.
Mm-hmm.
So movement therapy, as far as the lumbar spine is concerned, can be, or movement proficiency, as far as the lumbar spine is concerned, can be really defined by a set of rules. And our rules for maintaining healthy spinal biomechanics is hip-centric rotation, neutral spine awareness, posterior kinetic chain powered movement, unloaded knee positions, and proficiency limited range of motion. Okay, so those are the kind of like the 5 golden rules for lumbo-pelvic movement biomechanics. And so you can write them down on a piece of paper, and that doesn't mean much to a patient initially, okay? But once they start engaging in movement training or movement therapy, which is very different to exercise, these are motor patterns, right? These are motor patterns that we're trying to instill in the brain so that when the patient sees their mobile phone on the coffee table and they bend over to pick it up, or when they see the dishwasher has to be emptied and they start emptying the dishwasher, and when they are bending, they are expressing A+ movement points of performance. And once they start getting that movement pattern default, that changes the biomechanical stress on the joint. And when you change biomechanical stress on the joints, you reduce biological inflammation. And when you reduce biological inflammation, you reduce nociception and pain, and you start to prevent the accelerated structural changes to the joint, which is what we're trying to do, is to prevent surgery. Okay, because every week, I'm in surgery tomorrow, putting nuts and bolts in people who haven't had that message in a timely way. Their joints are structurally compromised to the point that they can never be repaired naturally, and hence they need to have spinal fusion or spinal decompression surgery. And that's sad, because that is entirely preventable if that patient was given this advice, maybe 5 or 10 years ago.
Yeah.
And to date, I haven't seen any other program that actually defines movement proficiency for the patient. Okay?
Yeah, I have a friend of mine actually that, interestingly enough, he's a doctor of physiotherapy in Santa Barbara, and he's on Instagram, and he's been for the last year or so putting out all of these movements, exercise movements that mimic the movements that a baby or a toddler would make. And I always thought that was quite interesting.
Wonderful.
Yeah. And then there's that knees over toes guy who's doing similar things where, squatting down, baby squats all the way down, bending forward, with your knees past your toes and things like that. That's one thing that my father's missing as well. He had spinal surgery. He had a cyst in his lumbar spine in early 2010s, and had to get removed. And minimally invasive surgery, had a very good surgeon in Seattle, so all that went well, but he just did not recover well at all, and he had back spasms and started getting worse and worse, and started just crumpling more and more and more. And now he sort of walks with a stoop. Now he's given himself a scoliosis because he's just in so much pain that he's just crunched himself forward, and the only things that are comfortable to him are putting himself in these compromised positions. And unfortunately, he's never had a physical therapist or anyone else that has been able to straighten him out. Unfortunately, he has the diet right. He's been carnivore for 5 years now, but unfortunately hasn't had the right physical attention.
Yeah, he hasn't been delivered movement therapy after his surgery. And if you think about this cyst, I would almost bet that the cyst was a synovial cyst that comes out from an unhealthy facet joint, and then it squashes the nerves, and that's extremely painful. And yes, it needs this structural intervention. But if you actually say to the surgeon or the patient, your dad, you say, well, why did you get that synovial cyst in the first place? That synovial cyst arose as a consequence of his movement dysfunction. And it's a micro insult day in, day out for quite a few years, and then the synovial cyst expands and then becomes clinically overt, i.e. they get pain. So the surgeons are very good at addressing the downstream problems. We are very good. We've been taught to address the downstream problems very well. Okay, no different to, metabolic health. We can, you've got blocked coronary arteries, have you? Okay, wonderful. Here's your coronary stent. Here's your coronary artery bypass graft. Here's your beta blocker. Here's your ACE inhibitor. We're so good at helping people drowning, but we're, Greg Glassman, we're so good at helping people drowning, but we're terrible at being good lifeguards. Okay, it's profound. It's just it's so real. And so with going back to your dad, he's got movement dysfunction that created the cyst that then needed the surgery. And then after the surgery, no one got rid of the movement dysfunction. So the very thing that caused his problem is still lingering. And so, of course, he's not going to rehabilitate well. Of course, he's going to continue to suffer pain and disability afterwards. And I'd love to have the opportunity to talk to your dad if he's interested. We over the last 3 years, we've done a lot of work over video consultations, and movement therapy can be delivered via video consultation. Okay, because we don't need to touch the patient. Obviously, it is easier to deliver movement therapy with tactile cues, but and that means, yes, being able to put people in certain positions and give them tactile cues to respond to. But in actual fact, our movement therapists and our team of movement therapists are so expert at seeing biomechanics from the other side of the room that we can deliver movement therapy to people on the other side of the world. In fact, I'm delivering movement therapy to a doctor at Mount Sinai Hospital in New York.
Nice.
And she's had neck pain for 10 years, and she's in Mount Sinai Hospital. So she's got the world's best Ivy League orthopedic surgeon, the world's best, physiatrist, the world's best physical therapist, and none of them are helping her. And she's done movement therapy for 5 weeks now via Skype or Zoom or whatever it is. Yeah. And she's going, I cannot believe it. I cannot believe that my neck is starting to feel less painful every day. Because all we've done is we've improved the biomechanics, right? So, let's talk to your dad. I mean, it's never too late to start improving on movement proficiency. Okay, it's just like it's never too late to stop smoking. It's never too late to start low insulinemic diets. That's a sad thing that I hear all the time. I had this surgery and it worked really well for a year or two, but then all of my pain came back.
Yeah.
Neurosurgeons would call that adjacent segment disease. Okay. You would know. Did you do a bit of spine surgery in Oz? Back then? Yeah. We call that adjacent segment disease. It's not a disease at all. It's failed post-operative rehabilitation syndrome. Okay. Because you put some fusion device in the spine, and then if you don't correct the biomechanics, you get a force vector adjacent to the instrumentation. Okay, that is like a crowbar. Just say you fuse L5S1 because the L5S1 disc is structurally compromised, and that's causing a lot of pain symptoms. Yes, the surgeon comes in, very good surgeon, doing his bit, but he doesn't tell the patient that, hey, when you bend over to pick up your coffee cup or when you brush your teeth in the morning, try to keep a neutral spine and rotate through the hip joint. If that simple message was provided to the patient and they expressed that as default biomechanics, they would not get adjacent segment disease. It's that simple. It is that simple. It is, and that's the parallel with diet too, right? The solution is so simple that it boggles the mind of people who can see it clearly, like yourself. Why do we have an epidemic of obesity and metabolic syndrome and heart disease? It's all kind of curable with a very simple solution, and that's why Occam's razor principle is so pertinent. The most simple solution is often the best. Occam's razor.
Yeah, absolutely. Yeah. So when did you come on to your understanding about how diet relates to metabolic health and back pain?
Oh yeah, look, going back over 10 years, the story was that I went to get a life insurance policy, and I failed my blood pressure readings. And my general practitioner, who I never saw normally, just kept putting the blood pressure cuff because he wanted to approve my blood pressure so that I would have a legitimate policy. And I had to sort of come back again and do it until I had a reading that was satisfactory. Very honest general practitioner. And I thought, this is bizarre. Like, I do everything healthy. I'm medically trained. Why is my blood pressure creeping up? And it wasn't just my blood pressure. I was disgraceful. I had the love handles. I had the big puffy cheeks. I was not sleeping well. And I thought I was doing everything healthy. I was having the multigrain bread. I was having the cereal with the healthy food ratings. I was not eating cakes. I was not eating, confectionery, which was obviously bad. But I was having all of the complex carbohydrates, and that was creating prediabetes. That was creating prediabetes and insulin resistance. And I thought, and a friend of mine, who was actually my surgical assistant, and at lunchtime we would be all hoeing into our sandwiches, our healthy sandwiches and wraps, and he would just have a couple of cubes of butter. And he said, Peter, you're going to get blocked arteries eating that. Fat blocks your arteries. And he goes, David, what are you talking about? That's not how it works. And so it was just so profound that he said that. And I'm grateful for him. But that was like the light bulb moment that made me think, what do I really understand about health? And so I just kind of went back to my first year textbooks. I don't know whether you use Guyton's textbook of physiology. Mm-hmm. Guyton's, do you use that one?
Sounds familiar. I don't know if I use that one. Yeah.
Or Ganong was another one.
Yeah, I do remember that. Yeah.
Ganong's textbook of physiology.
Yeah.
And I actually emailed Ganong because you can in the insert you can contact the author. So I emailed him. I was surprised he actually got back to me. And there it was. It was excessive consumption of carbohydrates. Or the consumption of carbohydrates requires an escalation of insulin. Okay. Yeah. And what do we know if we constantly drive insulin secretion? We then drive insulin resistance. Okay. We then drive insulin resistance. And then it all started to come into perspective. And if I don't want insulin resistance is synonymous with carbohydrate intolerance. Mm-hmm. And if I'm carbohydrate intolerant, the way I regain my insulin sensitivity is just stop eating carbohydrates. Okay, so then it was like, okay, throw the bread machine out, never buy rice again, never buy potato, and it was just like bacon and eggs in butter. And guess what happened? Without even trying, I got a 6.
Yeah.
With not one sit up because sit-ups don't make 6-packs, right? And my blood pressure just came, and I started sleeping better, and my brain started working better. That was one of the disadvantages, is that your brain just keeps thinking. You just keep thinking. Your brain's functioning on ketones, and that's like the turbocharged V8 super fuel for your brain. And so all of the health metrics just came good. Everything. And so it was so profound. And when you experience it personally, you just tell the world about it. And of course, when you're in a consulting room, 3 or 4 days a week with patient after patient after patient who has all of the features of metabolic syndrome, you just go, okay, is your GP not telling you this? And then that Well, if I was as duped, then of course your GP is likely to be duped as well. And then you kind of heard the same old story. And then I was fully in, and I joined Low Carb Down Under, and I gave a couple of talks at Low Carb Down Under as well. Nice. And it's a wonderful organization, and you're on that journey now too. And it's just the challenges now are not so much about the science. The science is worked out. The challenges now is getting the information into mainstream media, because there are, as you said at the beginning, I think, conflicts of interest. It's a $1 trillion industry that is being supported by misinformation. And unfortunately, the public are kind of just the pawns in that industry. And, we're doing the best we can to get it out there. But there's different strategies, and slowly it's gaining traction. But, when you don't have billions of dollars at your fingertips, all it takes for Kellogg's or Sanitarium is to just put a $10,000 a week billboard on the highway that says, the goodness of whole grains, and puts a few ticks on it and a few food star ratings, and boom, you've now got a society of brainwashed people that go out and buy it. And that's the challenge. I think we've got to start with the grassroots approach, educate the people, and then the people demand real healthy choices, and the politicians then have to do what the people demand, because a lot of people don't realize that the politicians are not our superiors. We are their superiors, but the politicians will do what is popular. And if we can make the population have the majority with the mindset of you and I, then the politicians will actually do what we ask of them, and they will start to create taxes on unhealthy food and things like that will just, and subsidies for good food, for the farmers and things like that who are producing the really healthy food out there, that make it much more inviting and acceptable and tolerable for people to buy good food. And do you know how much a good steak costs now? A good steak is coming up to about, a really nice fatty steak, grass-fed, is coming up to around $30 or $40. Like, it's crazy. So a lot of people can't. There are arguments of how you can, but a lot of people just immediately think, I can't afford carnivore diet. Meat's too expensive. But obviously, if you're on a carnivore diet, you probably only need to eat once a day. So in some ways, you've got to make people realize that. And also, you can ditch all your medications and all your doctor's bills and your private health insurance bills. So if you actually do the math, it is affordable, but people haven't got that sort of ability in the short term anyway to do that simple math. And
also, how much is your life worth? I think it's worth whatever cost, to give myself, the right food for my life and my health and longevity and that of my children and my parents. That's more important to me than anything. And unfortunately, they are taking advantage of that now with the prices. But I think that the more we drive this and more drive the demand and say like, no, we're not going to be dissuaded from this. That's going to make people stop and take a look and say, okay, well, look, the money isn't actually going ahead with this and making more ranches, more cows, regenerative agriculture, helping the land, helping the people, helping everyone. It just grows from there. I also think that in the public sector, public system in Australia, Europe, and in certain systems in America, that it's actually a huge advantage for the politicians to promote this, because you look at doctors like yourself, doctors like Gary Fettke or Dr. Sean Baker in America, who were promoting dietary and lifestyle changes to their patients and avoiding surgery. That was saving the public system untold millions of dollars, and yet,
absolutely,
and yet get prosecuted by the system saying you can't do that. You would think that they would be all for this, saying, hey, you're saving me $2 million a year in joint replacements that we don't have to pay for. Fantastic. Here's a medal. But, they're not doing that. And so that to me is very strange. I don't know if there's some sort of, they just don't understand, and they think that because this is new, this could be dangerous, or they just have so many influences from lobbyists and things like that they're very happy with the system as it is. I'm not sure, but I think that you're right, that we have to make this a grassroots movement and make people understand this from the ground up. And that once that demand is there, saying, hey, we don't want the surgery, we want to just be better without surgery, and we don't want the medications and so on, that's when things are going to start to change.
Oh, exactly. I think, it is conflicts of interest that influence government policy. Like if you look at these American dietary guidelines, they're not really based in science. They're not really based on science. If you look at the Lancet EAT guidelines or manuscript, it's not founded in any scientific validity. And I don't know whether you've come across Dr. James Mukey. He was, I think he was actually nominated Australian of the Year in 2020. Unfortunately, his public presence was a bit diminished by the lockdowns. Okay. So he didn't get as much exposure as an Australian of the Year. But he kind of dived deep into our food dietary guidelines in Australia, and he exposed incredible conflicts of interest with our own NHMRC, National Health and Medical Research Council. And it was really revealing that that the big food companies were well entrenched in what sort of information is kind of allowed to get out. So those are the challenges. It's a big money game, and the government kind of has to turn a bit of a blind eye to us when they've got obligations to money coming in. They need that lobby group money to do their thing as governments. And so when we put the science out there, so we could save hospital waiting lists and we could save millions on the PBS. And it's just, you wonder why nothing happens. It's kind of like there's a bit of a roadblock, and it's going to take a very brave politician to stand up and say no to the lobbyists, and no, we don't want your $1 million subsidy, because that's how these big political parties function. It's through donations. Influence. Money influences policy. Yeah. So ground up approach, low carb down under. Doctors started to bloody do their thing, and the colleges. The colleges of medicine, the college of physicians, the college of surgeons. They're so disappointing. I'm just constantly disappointed by the AMA. I'm constantly disappointed by how they just toe the political party line. They're almost like an extension of the government policy. They don't really have any bite.
Unfortunately, I've spoken to, it's always said supposedly in most circles that you need to practice evidence-based medicine. That's always been, the sort of the catchphrase for, well, at least since I've been in medicine. But then you start talking to people that they don't want to even practice evidence-based medicine. You can argue what the evidence is, but they practice guideline medicine. They say, I don't care what the evidence says. I care what the guidelines say. And I actually spoke with a doctor at Low Carb Down Under who said that their head of department where they worked said that, and they were saying, hey, why don't we look at this? Why don't we enact this? This is what the evidence says. And they said that exact thing. I don't care what the evidence shows. I care what the guidelines are. And that's pretty scary, because obviously the evidence is, you're always going to be, if you're going evidence-based medicine, you're always going to be 2 or 3 years behind the cutting edge. So that's something that you accept, and that's fine. But guideline. The guidelines are about 10 to 15 years behind the evidence. And then, and then only if you get the right influences, because these are bureaucrats writing the guidelines. These are not doctors. It's not like, the Australian of the year and the best doctors all through Australia get their heads together and say these should be the guidelines. No, they might give recommendations if they're chosen for that panel, but they submit those recommendations, and then it's a panel of bureaucrats who then decide what to pick, and they may not come out anywhere close to what the recommendations are.
Yeah, well, guidelines should be developed from contemporary research, right? But even the research now is heavily corrupted, because when you do big studies, it takes millions of dollars, and those millions of dollars usually can only come from big corporations, big food and big pharma. Yeah. And so it's pretty clear, and we know from how many lawsuits pharmaceutical companies get, millions of dollars of lawsuits, but even then it's just it's like a 20 cents on the ground for them. It's nothing. It's a slap on the wrist. And there's many ways that they manipulate the scientific literature. Like they can do a study and it doesn't produce the outcomes that they want, so it just won't get published. Right. And so we can call that publication bias. We can call that publication bias, and we can use statistical manipulation of relative benefits and versus absolute benefits. That's rampant throughout the cholesterol lowering research. Dietary studies as well. Like if you look at how people look at Mediterranean diets or carnivore diet or low carb, high carb diets, the whole way that we collect scientific data in nutritional medicine is very dubious. Like it's probably the most poorly performed science out there, because it relies on patients sending in surveys of what they ate, and that's notoriously unreliable. Or you can then go, okay, well, I'll put you into a lab. I'll put you into a lab where I can dictate what you eat. And that's kind of moronic in a way, because if I put someone into a lab and give them a carnivore diet, and I give someone, and it's calorie controlled, and I give someone, a high carb diet of equivalent calories, and they're in a lab, what I've effectively done is I've suppressed that person's ability to express the hormonal influences of that carnivore diet. Okay. And so how can I expect to see significant differences? Because if I'm on a carnivore diet, I'm active, I'm moving around, I'm going for a jog, I'm engaged in my environment, because that's what it does to my endocrine system. Now I stick someone on a carnivore diet in 4 walls in a lab, and I've kind of eliminated his ability to express the benefits of that diet. And so, those are the ways that we misconstrue the evidence. And then when people don't understand, or they don't understand bias and how to critically appraise journals, then they come up with rubbish guidelines. Okay. So yeah, I mean, there's a lot of value in N=1 studies in nutrition, and there, if there was a way of collating all of those N=1 studies, that'd be incredibly powerful. And then the other little bias that comes up, say someone on a vegan diet or a vegetarian diet, that fixed my chest pain, or I fixed my asthma, or I lost 20 kilograms. And yeah, that's fantastic, because anyone who starts to take up a diet is this is called a dietary bias, right? Anyone who takes up a diet is suddenly making health conscious decisions.
Yeah.
So in collaboration with their vegan diet or vegetarian, they also stopped smoking, they also stopped drinking, they started going to bed early, and they started going for walks or whatever, right? So, okay, here's all these other association factors that came into the final outcome of, oh, the vegan diet is fantastic. And that's what then becomes the clickbait of what happened to me when I did the vegan diet and Mediterranean diet. But if you go and give someone the vegan vegetarian diet who has insulin resistance, that's not going to work. Because a vegan vegetarian diet is going to be very high in glucose. And we already established that insulin resistance is equivalent to glucose intolerance. And so that's no different to you giving someone who's got a nut allergy peanuts. And you would never do that, right? You would never go, oh, okay, kids, you've got nut allergies. That's okay. Everyone come in with your peanuts, right? But when it comes to insulin resistance and they've got glucose intolerance, the problem is just keep eating your glucose. Here's your metformin, or here's your insulin. That seems to be okay.
Yeah. And also those epidemiological studies, obviously the surveys are a bit flawed in many ways. First of all, because they say pizza has sometimes have toppings that are meat, therefore pizza is meat. And so if you self-report that you eat pizza, they count those as servings of meat. And obviously that makes the meat eating parties a bit worse. And so that's just fraudulent. But anytime you go to a whole food diet from the standard processed diet, you're going to get an improvement, I would say. And even if you don't drop all the other things, I mean, you're just cutting out things that are harmful to you. And what I point out to people is you go to a whole food plant-based diet from a processed standard American diet, standard Australian diet, you're actually just replacing worse plants for better plants, right? Because you're still 70% of the standard American diet is plant-based. It's just processed carbs and sugar make up the majority of that plant-based. So now you're replacing those plants with just vegetables and things and fruits, which are arguably much, much better, but it's still plants, right? You're still plant-based. You were already plant-based. Now you're just different plant-based. And that's something that people don't understand as well. And, but none of these studies compare what we're looking at when we're talking about a carnivore diet or even a meat-centric diet, because none of these studies look at a whole food plant-based diet versus a whole food meat-based diet. They look at a whole food plant-based diet or more whole food plant-based diet versus the standard diet, just whatever anybody else is eating. And they might try to say like, oh, well, this person eats, less servings of meat, which pizza is included and all that sort of stuff. But that's still not comparing like to like.
Yeah. Yeah. That's right. And the plant-based diet, there's a lot of push coming from the new concern that everyone has, which is, carbon emissions.
Yeah.
And so, I can see people going, oh, no, we've got to move towards this plant-based diet because that's healthier for the planet. And now we've got almost this new insurmountable message that we've got to try to overcome for the people who are the environmentalists and all that.
Yeah.
Boy, it becomes even more challenging when you layer that on top of the whole discussion, doesn't it?
Yeah. Well, that's a good thing about the regenerative agriculture movement with the, regenerative livestock, they're rotating animals around and their fields are just getting more and more verdant. And then you contrast that. I mean, they'll have ranches right next to each other and same acreage. One ranch is able to support, 5 times the animals because they rotate these things in such a way that it promotes growth of the grass and the plant life there. Whereas the other time they're just like, oh yeah, just cows on the field, just let them do their thing. But if they're rotating them, moving them through like they were a herd of cattle or animals moving through the area, but not eating it down to nothing, and then they move on and different things come in behind them. And there's all this whole big process that you would see with migratory routes and things like that. And it's very beneficial to the land. And that's something that's becoming more and more, people are made more and more aware of that, which is great. And I think people can vote with their pocketbook and say, okay, well, I'm going to support that rancher that's doing things the way that helps the environment. I'm going to buy a cow from that guy. I'm going to buy my meat from that guy, which I think is the right way to do it. And that's going to encourage people to ranch that way, and because there's a market for that. I was just thinking too, the only, we don't have any studies yet. I think we should do these with, comparing whole food plant-based with whole food meat-based. But there was a study published in JAMA, the Journal of the American Medical Association, in 1931, looking at the Maasai and the Akikyu, who's if I pronounce that right, which is an African tribe that live right next to the Maasai. So this is a genetically similar population because they actually intermarried and interbred. So genetically similar populations. And the Akikyu were actually displaced off their land, so they didn't have their normal hunting and the normal access to food that they used to have. And so they went to a more plant-based diet. But this is in the 1920s that they were studying this, and published in 1931. So there's no, this wasn't like some large scale industrial, farming project with a bunch of pesticides and chemicals. This was in the middle of Africa, just eating whole foods that they were growing or foraging, and very little meat. And so that's a perfect, it's a vegan's dream, just the perfect, plant-based diet, whole food, no pesticides, no added chemicals. And contrasted with the Maasai, which, famously eat essentially a carnivore diet of just, meat, blood, and milk. And they looked at the health differences, and they did a very deep dive into their physical characteristics and their dental health, their physical health, and their blood markers. And they found that the Maasai were far more healthy than their neighbors who were genetically similar. On average, even though genetically similar population, the Maasai adult males were 5 inches taller than their counterparts. So right there, that's a huge difference in development. Their teeth were better developed, their jaws were better developed. They weren't getting cavities like the Akikyu were. The Akikyu were more likely to have developmental issues and growth deformities and bone deformities, tooth and jaws. They had mineral and vitamin deficiencies, iron deficient. A lot of them were quite iron deficient, and would get anemia as well. And they would get sick more, and they would get sick more often. They had other sort of health issues. And they found that when they tried to just supplement the missing nutrients that they found on blood work, that they actually didn't really help them all that much. But when they fed them meat again, they basically reversed all of their health issues, and they got very healthy again. And so that actually is exactly what we're looking at. That's exactly what the argument is. Whole food, plant-based, whole food, meat-based. That's what we're looking at, because you compare a carnivore diet to a standard American diet, that's going to get better as well. And that's what, like, vegan proponents will say, well, that's all we're seeing. All the people that are improving on a carnivore diet, that's the only thing. It's just improving from, from the norm. And it is improving from the norm. But, they say that long term it's going to be a problem. Well, so far it's been 23 years for me. I haven't seen a problem, but but they're saying, well, actually the most sustainable diet for longevity and health is the vegan diet. So we're sort of making the same argument as why they're seeing benefits and we're seeing benefits. But when you actually look at that study, you actually look at whole food, plant-based, whole food, meat-based, you see a very stark difference in the generational outcomes in health and development.
It's fascinating. I hadn't heard of that study, but it's just so fascinating. There's your clinical model right there. That should be in the first chapter of any nutritionist textbook or dietitian's textbook. But I think the vegans, to be vegan and vegetarian, you have to be so meticulous to obtain all of your micronutrients. You have to be very, very methodical about choosing different plants and whatnot that will allow you to get the iron and allow you to get your B12. I haven't seen a single patient who's meat-based with spinal cord degeneration, but there's a lot of vegans who spinal cord just melts. We call that subacute degeneration of the spinal cord, demyelination. You need B12 to maintain the health of your nerves and cholesterol and fat. It's extremely hard. And, any vegan, most vegans were probably taking some form of supplements,
Mm-hmm.
If you're eating lamb chops and steak and chicken and pork and duck and fish, you don't need any supplements.
Mm. Yeah.
So the diet, as you said, it's a whole food diet, nose to tail. You don't need to supplement. But, the thriving stores out there now are the supplement stores.
Yeah.
Yeah. To supplement people's diets when they're not on a proper diet.
Yeah. And that's the thing, if you have to supplement, then by definition, your diet is deficient. And the argument that we're herbivores is remarkable to me for the simple fact that you just cannot get even basic nutrition from a vegan diet. It just doesn't exist. You can't get your B12, D3, K2. You won't get enough vitamin A. You'd have to eat, 2 kilos of carrots a day to get enough vitamin A. You're not going to get all the essential fatty acids like DHA, EPA. We don't make them well enough ourselves. We do need those from a dietary source. And there's so many more. There's so many others that we don't even know. I mean, you can get the straw man argument is when vegans say, like, oh, well, people say you're not going to get it. Where are you going to get your protein from and all that sort of blah. No one's actually arguing that you can get a complete protein from plants. You absolutely can. It's not as bioavailable. It's harder, but it is possible. Of course, it's possible. I'm saying you can't get other things. Protein's fine. You can get all the protein you want. That's not a big deal. But there are other nutrients that are essential that you have to have. There was a position paper. I think the group was called like SPEC or SPEC or something like that. It's a group of pediatricians in Italy, and they basically wrote a position paper on the vegan diet, vegetarian diet, and they said, look, this is a bad diet for kids. This should not be promoted or given to kids. Any diet that is deficient in essential nutrients cannot be a good diet. So you should not give your kids this stuff. They're developing. This is when proper nutrition is most vital. And so that actually isn't a fringe opinion. I mean, this is just a biological fact. Like, we cannot get appropriate nutrition just by eating plants. You have to supplement. And they even argued that, said, well, but you can supplement. So ethically, you should supplement any of this other stuff. But as we know from the Akikiu study, supplementation actually didn't cut the mustard. It wasn't good enough to get them back to better health. There are more supplements. There's more nutrients that you're missing there too that we don't know about. And you're bringing in different sort of plant toxins and things like that. That was actually, just to sort of get down a tangent. That was actually, there was something I was speaking with someone the other day, and they said that Lane Norton, who's a nutritionist, said that, well, if plants are trying to kill you, they're sure taking a long time to do it. And that's the point. Slow poison is still poison, right? If you die 20 years early because you're smoking, like, that was a poison, that was harmful. No one denies that. And so when you say, like, well, spinach and all these sorts of things, like, they're not really poisoning it. Well, it can take a long time. And what really we don't understand is that things like Crohn's disease, diabetes, even heart disease, even forms of cancer, these all come from these things that we're eating, and we just call them diseases. But what we need to understand is actually that is coming from the toxicities from the food that we're eating. So you're saying, well, it's taking its sweet time to poison us. So, like, that's just someone who doesn't recognize that Crohn's is a symptom of that poisoning, that those plants, the poisoning from these plants manifest as Crohn's disease, ulcerative colitis, rheumatoid arthritis, gout, heart disease, cancer, all these sorts of dysfunctions. So that's the problem. So in fact, it's very evident. We're seeing this all the time. There's very prevalent increase in all these chronic diseases, which really are the toxicities from plants. So, that's just something that we need to understand, is that this is coming from things that we're eating. Perfectly evidenced by the fact that there are studies right now looking at Crohn's disease, that if you put someone on an elemental diet, but you just give them core micro and macronutrients and eliminate everything else that they're eating, that is a better intervention to get someone out of an acute flare-up of Crohn's than prednisolone, right? Which should just work like that. But just having them not eat the things that are causing the disease is better than the prednisolone. There was also a study that showed that with two groups, a randomized control trial with Crohn's disease, again, looking at the intervention group was eliminating carbohydrates and fiber. And so the group that eliminated carbohydrates and fiber stayed in remission from Crohn's for 51 months. And then the group that still ate carbs and fiber stayed in remission 0 months, right? So there's a big contrast there. And so that shows, again, that there's something that we're eating that is causing the disease. So what that is toxicity. That's fiber and carbohydrate toxicity. Your body is responding to this in a negative way, and that's manifest in Crohn's disease. And that's also an argument against fiber, saying, "Whoa, there's all these studies that say fiber's so great, fiber's so great, fiber's so great." Well, not if you have Crohn's, because if you want to stay in remission from Crohn's, you obviously do not want to eat fiber.
Yeah. Yeah, that's amazing. And again, the doctors are happy to prescribe prednisone or salazapine or all of the other, immune toxic bombs, but they kind of leave something like, hey, just maybe switch your diet towards something that your body is more evolutionarily, physiologically developed to consume. And what about the microbiome? Because I have heard the plant-based people talk about that, that's what our microbiome likes. They like plants. And I'm not convinced. I mean, it's only an area that I'm starting to look into, but carnivore diet and the microbiome, because our microbiome is extremely influential on our metabolism, from what I understand. So can you talk a little bit about that?
Yeah. So well, I mean, I think we're still figuring out the microbiome, but I've spoken to a number of people that study this, and they find that actually they're all for the carnivore diet, because they find that people on a carnivore diet have a very biodiverse microbiome. So there's huge array of different bacteria, which they say that's a very good thing. And the makeup of those bacteria are actually all the more favorable bacteria. So they're actually all for that, the ones I've spoken to. And then you look at the different sorts of bacteria. I'm blanking on the names. However, they're the ones that really like carbohydrates and really like fiber in particular. And those have strong associations with different sorts of diseases like multiple sclerosis and rheumatoid arthritis. And so, is that an association? You're just you're eating something that's triggering the RA or the MS, and that also promotes these bacteria, or do the bacteria have some sort of influence as well? I don't know, but they do see that association with these bacteria, and those are bacteria that are promoted by eating those things. And we also see when people come off of those things, their RA and their MS actually improve. So something's happening there. Yeah. The other argument is that, well, this feeds your gut in a very direct sense by, we still have or can cultivate some of the bacteria that can break down fiber, not much of it. Our appendix is a vestigial, cecum that used to be very long, and that's where fiber would pack into and break down into short chain fatty acids and protein. We don't have that anymore, but we can, it still does it to a small extent. And they say that breaking that down into, was a butyrate, that is really good for your enterocytes, And so it's just like, great. So you want to eat fiber because that feeds your enterocytes. Well, you make butyrate and butyric acid, anyway, just by one of your major ketone bodies is butyric acid. So that's already going to give your intestines its most preferred, or if it is its most preferred fuel source, it's already there providing that. Also, butter has tons of it. That's where it gets its name. And so, the arguments I don't think are too strong in that category. And the bacteria complement that we seem to find in people on a carnivore diet is perfect. Is exactly what it seems to line up with proper health.
Yeah, it may be that gut biome discussion and that gut biome science and leaky gut syndrome related diseases is going to be a powerful way of kind of consolidating the philosophy that we have. And it may be so because the metrics of measurement are much easier when you're talking about that type of thing. What is your gut flora like? It's much easier to see advantages. And I wonder whether that's kind of why it's not being heavily promoted, because it's kind of so stark that a meat-based diet creates very black and white improvements in these conditions and measurable inflammatory markers and celiac disease and that type of stuff, that it's kind of too indisputable, and it kind of blows the other arguments out of the water when you talk about alternative styles of eating. And so, as a general rule, people don't really go down this path of talking about the microbiome. And maybe there's some factors happening out there that are aware of that to minimize the science relating to it, because they know the outcomes are going to be pretty detrimental to the commercial food industry, which is really based on sugar. And the other interesting thing, just to add to what you said about that, is that cows are actually carnivore in a way. They eat grass all day, but as you said, they're ruminants, right? And they've got these amazing guts that have the ability to convert their carbohydrates, cellulose, and all that fiber. They convert it to butyric acid. So they're actually a carnivore. They're eating fat. Yeah. A cow is absorbing fat across the gut membrane. They are not absorbing glucose and cellulose. They are converting it to fat, which is also profound. And so because we don't have that type of gut, we should be eating more fat, because that's physiologically what our body needs. So that's another little profound little indisputable fact for the vegetarians and vegans out there.
Yeah. Well, and you're exactly right. Yeah, I think that describing animals as carnivores, herbivores, omnivores, I think misses the mark a bit. I think we should call ourselves fat and proteinivores, right? That's what we need. We need fat and we need protein. That's what runs the animal kingdom. And however you derive that nutrition, however you can get that from what source, is a bit immaterial. I mean, the point is you're trying to get that to its maximal, extent. And so a cow is able to do that through grass. A gorilla is able to do that through specific leaves and so on. We're not. We really can't derive fat and protein from leaves or salad or spinach. So we need to get that from another source, and the best source to do that from is an animal source. The cow's already done the work for us, and now we can subsist and thrive on that fat and protein. But we're all running on fat and protein. Now, maybe something like hummingbirds or insects and things like that eat nectar, they have a different system. But the majority of animals on this earth run on fat and protein. Yeah. Yep.
And that ends up keeping their insulin sensitivity, right? That ends up keeping their insulin sensitivity. The funny thing that the patients always say to me when I say, are you diabetic? And they say, they clearly are pre-diabetic or actually diabetic. And I say, no, my doctor's done my blood tests and my sugars are perfect, right? The doctors never test fasting insulin.
Right.
Why is the standard metabolic health screening not testing fasting insulin? Because our government in Queensland anyway recently promoted the free blood test health check. And I looked at it because someone came up to me and showed me their blood test and said, "What do you think of these, David?" And of course the fasting glucose was checked. I said, "They haven't checked your fasting insulin." If we actually started checking fasting insulin, we would identify so many people with pre-diabetes and insulin resistance. And therefore, indisputable insulin resistance, you've got to reduce your carbohydrate. But a lot of people do not understand that their glucose is is normal only because the pancreas is just working in overdrive. So if you don't actually do a test to confirm that your pancreas is working in overdrive, you will not know that you are pre-diabetic. And that's a big failure as well. I don't know what is driving that. I think GPs feel that that's an over-investigation. But whether they get a slap on the wrist if they order too many fasting insulins, but I order it all the time. And I find insulin's, well in the tens, in the teens, in people who think that they are metabolically healthy, or they're told that they don't have diabetes. They have pre-diabetes. So that's another systematic failure, that could be easily changed.
I agree. I check for that all the time. That's a very normal blood panel that I look for in the metabolic health functional medicine clinic that I work in. And I remember one of the talks in low carb Denver just this weekend. They were saying that you're going to have elevated fasting insulin for 10 to 15 years before you start getting those deranged blood sugar markers, right? So that's really what you have to look out for. And so you're going to be picking that up well in advance of when there's an actual problem. When you start getting your elevated blood sugar, that means your body is decompensating. You cannot handle it anymore. It's doing the best it can, and then all of a sudden the wheels start falling off. So you want to get a tune up long before your axle flies off your car and you go off a cliff. So it's very important to look at those ahead of time. I agree.
Yep. What do you think about athletes? So, I work with a lot of athletes, and I see it in the functional fitness arena in CrossFit. And, I follow some athletes, and they love to show what they had for breakfast. And, it's oatmeal and rice and potato, and it's sad because it goes very much against one of the fundamental pillars of the sport that I love, which is CrossFit, and the nutrition in 100 words that Greg Glassman came up with, 20 odd years ago, or late around 2009, or 10, 11 years ago. And now the athletes who are at the top of the game are sort of flouting that and describing how many carbohydrates they're consuming. So it kind of thinks, it kind of portrays that, oh, look, I'm extremely fit and extremely healthy and extremely powerful, and I'm doing it with carbohydrates. And so that's a challenge as well, especially in social media, where you're seeing these glorious bodies and people who are consuming a kilogram of carbohydrates a day because they kind of feel like this is what it takes to become a superb elite athlete. What are your thoughts on that?
Yeah. Well, at the peak of my athletic ability, I was not eating any carbohydrates for years and years and years. And that was a period of about 5 years, between about 20 and 25, that I was absolutely unstoppable physically. I mean, I kept playing at a very high level after that, into medical school and through medical school and beyond. But I've never in my life felt or performed better than during that time when I was not eating carbohydrates. I was just eating meat until I was 38 years old, and I figured this out again, and I stopped eating again, and instantly I was back in I had the physical stamina and endurance and recovery that I did when I was 20 years old, 22 years old. And people say, well, you're in the early 20s. Of course, that's when you're at your peak. But I peaked again at 38. I was better at 38, having not worked out, having volunteered in a refugee camp for months, and then not done any work and not run really significantly in a year or two. And then, but I was eating the right way. I was only eating meat. I was not eating any carbs. And all of a sudden I'm doing dead sprints and running up and down the field with a bunch of, people in their mid 20s or professional athletes, on the professional rugby team, the Seattle Seawolves. And I felt great. I felt better than when I did at 27, I was just absolutely, shredded, low body fat percentage, playing, high level, rugby's in the Rugby Super League in America for the San Diego On-Back team. I felt way better at 38 than I did at 27 or 28. So that was my personal experience with that. And so that's, what I try to relate to people. But as we know from, studying biochemistry, when you stop eating carbohydrates, you make all the carbohydrates you need. You don't need to eat the carbohydrates. Sure, you need glycogen, you need blood sugar. Yeah, you absolutely do. That's important. You make them. And the benefit of making them yourself is that you don't run out, because you're tapped into your fat stores and you can keep replenishing your blood sugar and your liver glycogen. Whereas these guys have to carbo load. They have to eat just tons and tons and tons of this stuff so that they can fill pack their liver and their muscles with as much glycogen as possible. But that's a finite resource that will run out. Whereas if you're not eating that at all, it's unlimited, because you will constantly replenish it. So your recovery is much faster. You don't get tired in the first place. You never hit the wall. Also, you're not debilitating yourself in other ways. You're not getting these insulin swings and these which can also disrupt your metabolism in other ways. It can disrupt your hormones in other ways. So you're going to optimize your hormones. You're going to optimize your health. You're going to optimize your energy, and you're not bringing in these different sorts of plant toxins that can also cause harm. I don't get sore. I recover much better than I did. I was always sore. For years. I mean, most of my life I spent being sore, and I thought that was a good thing. That means, oh, wow, I've worked really hard. Look at me. I'm so sore. I'm crippled. I can barely walk. That means I put in a lot of work. But that's actually not the case. That comes from these inflammatory factors in plants, and then you eliminate those, and you eliminate that pain, stiffness, swelling, and soreness, and you recover better, and you can perform better, and you can train more. So when you're looking, when serious athletes, or people who want to become a serious athlete, are looking for that significant advantage that they can get on their opponent, this is it. This is such a major one, because, just that simple fact that, you won't run out of energy in the same way. You won't run out of glycogen, but you'll recover so much better. The next day, for the next 2 days, 3 days, you're not going to be just crippled and sore and pain. You're going to be up and going again. Yeah. So you're going to be training for 3 days before that guy is even able to walk properly. That is the biggest advantage you'll ever have in an athletic endeavor, is more time on the field, more time on the track, more time on the court, and just more time putting in the work that you need to make yourself a top athlete. And so even if it didn't provide any significant advantage in the competition, which I think it does, it provides immense benefit just from being able to exercise more, work out more, train more, recover faster, and get more from your workout. So I think that is one of the biggest advantages that any athlete or any aspiring athlete can take. And it's something that more and more people are coming to. I've worked with many athletes, many top tier athletes. One guy I've had on my podcast, I'll be interviewing him again in the coming weeks or months, Ryan Talbot. He's a Division I NCAA decathlete. And he went onto a carnivore diet and was talking to me about it. I was like, hey, how do I do this? What should I do? And so I was just sort of giving him some advice, and his performance just started, his athleticism in general just started increasing dramatically. And he said to me, this diet has finally turned me into the athlete I've always wanted to become. And he ended up in his second decathlon ever. He won the Big Ten championship for Michigan State, and won All-American honors, and set the school record for the decathlon. And it was near Olympic qualifying level, his score on the decathlon. So that is a massive benefit that he found. And there's a number of rugby players that are doing this right now in Australia that are not telling anyone, because like I said, this is a huge advantage, and they want to keep it an advantage. They don't want other people to get on this. I want everyone to do this. I want everyone to be able to get on this and see for themselves just how amazing it is. And I know rugby players in America as well, who I've spoken to, who have just, like, for instance, one gentleman is on the USA national team, and he he said to me that he went onto a carnivore diet or a near carnivore diet, and his testosterone levels went from it was like 450 up to like 1100. It was just this massive jump in his testosterone, which is going to obviously help in athletic endeavors. Yep. So, you're going to optimize your hormones. You're going to optimize your health. You're going to eliminate all of these inflammatory factors and different sorts of toxins that are going to debilitate your ability to perform at your optimal level. And it's going to allow you to train more, train harder, and get more out of it. So if there's anything on this earth that can help an athlete become the best that they can be and beat out the competition, it is a carnivore diet.
Wow. Well, there you go. I mean, anyone who's listening who's a high level athlete, that could be the secret. That's the secret weapon, right? The carnivore diet, or the low insulinemic, low carb diet. Because a lot of top level athletes, they all train ridiculously hard. Mm-hmm. They've all got a good head game, and you think, well, what is going to give me that edge on, what is going to get me first place on the podium versus second or third? They're all equally talented, and they probably, at the moment, their advice from their nutritionist team, it's always high carb. And you just see it all over social media. But there we go. That's sensational. I'm going to show that to my gymnasium athletes, the top level athletes. And in addition to that, I think longevity of cardiovascular health, because think what you're doing to your LDL profile, what you're doing to your pattern B LDL profile when you're consuming crap loads of carbohydrate every day. You're just producing your sugar gets converted to triglyceride. Your triglyceride gets converted to your VLDL, and then that goes up the chain to your low density lipoprotein, and then you get the glycation, and that LDL does not get reabsorbed. It then just hangs around and just becomes more small, dense pattern B. And these super athletes are actually lining their coronary arteries with oxidized LDL. And so, you occasionally see it where these amazing athletes have heart attacks at, 45 or something. And they were elite, healthy athletes. That's what they don't realize, even though they are muscular and they're not overweight, because they're grossly insulin sensitive from their muscle health. Even though they are consuming carbohydrates, they're just grossly insulin sensitive. But what they cannot stop happening is the liver's conversion of glucose to bad, small, dense LDL. And that's the molecule that is atherogenic, and they don't realize that. So that's even another reason to not get a heart attack, not just to get on the podium, but to not get a heart attack at the age of 45, which I've seen a lot of people, top level athletes with angina. And how could it happen to me? I'm a elite athlete.
Yeah.
So,
no, it's
fantastic. We covered a lot of stuff there, Anthony.
Yeah, absolutely. Well, I'm conscious of your time. I know you're getting into your work day, but just so people know, like what are you eating now? Are you full carnivore now? And if so, how long have you been doing that? And what are the benefits you've seen? Well,
there's a couple of nights of the week where we will just have a ribeye fillet or lamb chops or chicken. Okay, so there's a couple. I'm not as fastidious as yourself, being 100% carnivore, but I follow what I consider sort of an 80-20 or a 90-10 rule. And for sure, there'll be one or two nights a week where I'll be out with friends and we will have some carbohydrates. But I try to explain to people that the 80-20 rule works from a position of health. And a lot of people don't realize that, when they always say one size doesn't fit all, everything in moderation, that's kind of a cop-out. And that if you have disease, if you are obese, if you are overweight or pre-diabetic or insulin resistant, the 80-20 rule won't work for you. The 80-20 rule, you have to then apply the 100-100 rule. Okay. And then you can earn the privilege to then apply the 80-20 rule. And so thankfully, I am healthy. I'm metabolically healthy. I'm physically healthy. So the 80-20 rule works for me, and it's okay. And if I maintain that 80-20 rule, I will most likely stay healthy. If I start to slip a bit and I go, 60-40, then I'm starting to compromise my metabolic health. And to regain it, I then have to be diligent and apply the 100 rule so that I can regain that privilege to use the 80-20 rule. So that's my message, is that don't think that the 80-20 rule works for you when you are coming from a position of poor health. You've got to earn the privilege to have the 80-20 rule applied. So yeah, we are predominantly, like you said, it would be a meat-centric whole food diet.
Great.
That would be how I eat. But like, you have to be pretty 100% low carb, less than 50 grams a day if you're unhealthy. If you've got high blood pressure or if you want to lose some weight, you got to be even more diligent for that for a little while, maybe for 6 months. And then you'll then be able to restore insulin sensitivity, which allows you to then be a bit more 80-20-ish. That's how our family eats. And even my young children, they already wake up and have bacon and eggs. There's no such thing as porridge or cereal in our house.
I wish I grew up in that house.
They're so lucky. They're kind of lucky having that knowledge at such a young age, which makes me super, super happy.
Yeah, definitely. Yeah. Well, Dr. Johnson,
if anyone wants to learn a bit more about, I'll just give a brief plug to the to the Functional Movement Training Center.
Please do.
Anyone, and there's a lot of people out there with spine-related pain. If anyone would like to get in touch with us about their spine-related pain, please do on info@fmtc.com.au. That stands for Functional Movement Training Center .com.au. We also have a YouTube channel called Functional Movement Training Center, and our the Instagram platform for our information relating to the College of Functional Movement Clinicians is called NeuroHab, which is NEUROHAB_movement_therapy. And that's the Instagram platform for our movement therapy program. And for clinicians, if say you're a physiotherapist or a chiropractor or a personal instructor, personal trainer, we want you to get on board and collaborate with the College of Functional Movement Clinicians so that we can just broaden our reach of delivering movement therapy and trying to reset that as the paradigm to prevent this epidemic of musculoskeletal pain.
Absolutely. Well, thank you very much for that, and I'll put all of that in the description when I post all this, and do all the links as well. So, I was going to say, that's it. So thank you so much. I really appreciate it. I really appreciate you taking the time. That was absolutely fantastic. I think people will get a lot out of that. And so please do find Dr. Johnson there. If you have any questions, please contact him at the information provided. My social media is Anthony Chafee, MD on Instagram and YouTube. Obviously, the podcast of Plant Free MD, and then on Twitter is Anthony_Chafee. Please like and subscribe to these different platforms. It really does help get the message out. And if you like this and you think you have a friend or someone who would benefit from seeing this, please do share it with them. And thank you very much. And we'll see you next time.
Bye-bye now.
Bye now.
Hey guys, thank you very much for taking the time out to listen to what I had to say. If you like it, then please like and subscribe to my YouTube channel and podcast. And if you're on YouTube, then please hit that little bell and subscribe, and that'll let you know anytime I have a new video out, which should be every week, if not more. And if you could share this with your friends, that would help me get the word out and let me know that you like what I'm doing. Thanks again, guys.